Good afternoon. My name is David Baiada. I'm the CEO here at Bayada Home Healthcare. Today is Monday, March 30th, and this is your daily CEO update. I wanted to focus today on the idea of community. The Bayada Way describes our community of compassionate caregivers, and that community has never been more important than now. One resource that we have in place that I've mentioned in a prior episode is our Bayada prayer line. We went live today with the Bayada prayer line, where you can make a phone call into one of the two numbers on the screen at any time during the day to access prayer.
Hello. Please join me in prayer. Giver and sustainer of life, we stand shoulder to shoulder, sit knee to knee with others our whole lives. And yet now, when we need the comfort of someone close, we're faced with a deeply puzzling dilemma.
That prayer will be led daily by one of our Bayada chaplains from the hospice practice. And I encourage you to access this either for you, your family, your clients, or anyone out there in the community. It's a publicly open prayer line available to anybody that needs it. Secondly, I asked our Chief Medical Officer to record some of his reflections and perspective on this idea of community and how we can support each other. Let's listen to what Dr. Groff had to say.
Hello, my name is Adam Groff, and I'm Bayada's Chief Medical Officer. So I'm here today to first off introduce myself. Over the upcoming weeks and months, I plan to update you all with the ongoing COVID crisis and what we're learning. I also want to talk about our critical mission as home care professionals and how we can help to solve this COVID crisis. I want to talk about fear and how we clinicians can deal with our fear while serving clients. And then finally, just want to talk a little bit about our shared purpose and our important role in all of this. So a little bit about me. I'm an internal medicine physician. I practice part-time as a hospitalist in New Hampshire. I've got 4 children. My wife's a pediatrician. And I've been with Bayada now for, this will be going on my 11th year. And you know, the way I look at our mission in home care, in home health and hospice, is to care for people at home who need us to make sure that they're safe and to help alleviate suffering. And I think that is the exact same mission that we have with COVID, right? We need to make sure that people are safe at home and we're alleviating suffering. And why that's important is by doing our job really well, we're going to help hospitals who are going to be getting many COVID patients. We're going to be able to help them make sure that people can go home or stay home so that those beds are open for other people. And we're going to have friends, family, even ourselves who may need to be in the hospital. So everything that we can do to make sure the hospitals have space by keeping people home, that's a wonderful thing to do. Fear. So when I first started learning about COVID, it made me nervous for myself, for my wife, who's a pediatrician, for my friends, for all of you who are on the front lines. Should I be scared about this thing? And I think many of you are also probably dealing with some fear. The more I've learned about COVID, the more I've come to understand that this is a very manageable disease, that we as well-trained professionals, we are no additional risk in comparison to people in the community. At the end of the day, it's very likely that all of us, or most of us, are going to get COVID at some point. And most of us are going to, maybe be a little bit sick, but be fine. Some of us are going to require hospitalization. Others will require an ICU care. And it is scary, but the fact is that if we, take care and use appropriate precautions in the home, our risk should not be higher than it would be if we were with our kids out on the playground or with our going to the grocery store, where we may let down our guard and become infected. So as long as we follow great precautions when we're taking care of COVID patients in the home, we should have no higher risk than we would at home. The final thing is our shared purpose. We have a huge battle in front of us, and we have an incredibly important role in helping to solve the COVID crisis. As compassionate caregivers, our greatest weapon is love. the love that we have for our families, the love we have for our communities, our nation, our colleagues. And love is, what will drive us to help people with COVID. And love is what will help make sure that we are making the world a better place for our kids and grandkids, nieces and nephews, and make sure that once COVID is said and done, we've done our part to help. I'm super optimistic about the future. I think this is going to be a hard battle, but many thousands and millions of people around the United States and the world are working super hard and dedicated against the COVID crisis. So thank you. I'm super proud to be part of this team. I'm inspired by all of you. I'm inspired by people jumping in to already care for COVID clients. So let's get the job done. Thank you.
Once again, the critical community we have is what's going to help us navigate this crisis together. Thanks for leaning in, for being a part of this community of compassionate caregivers. I'm grateful for you every single day.